What is gigantism? Gigantism is a very unusual condition in which a child has too much growth hormone in his or her body. This leads to them growing very, very tall. Gigantism can be treated, but early diagnosis is essential to avoid having children grow too tall and experience other complications. Symptoms: excessive amounts of growth hormone cause many signs and symptoms of gigantism. A main symptom of gigantism is excessive growing. Gigantism produces children that grow very, very tall. Apart from being very tall or large for their age, typical physical features of gigantism are very prominent forehead, large jaw, gaps between teeth, thick features on the face, and large hands or feet with thick fingers and toes. Other symptoms of gigantism include enlargement of internal organs, especially your child's heart, excessive sweating, double vision or difficulty with peripheral vision, headaches, joint pain, delayed puberty, irregular menstruation, sleeping problems such as apnea, and muscle weakness. On the left, you'll see an image of two hands. The hand on the left is a normal hand, someone that does not have gigantism. And on the right, that hand is someone with gigantism. As you can see, there's very thick, long fingers. And on the image on the right, the person on the left has gigantism. He has very thick features on the face, a bigger forehead, and his hand is larger than normal. And the person on the right is someone who doesn't have gigantism. How it affects the organ system. Gigantism is a growth disorder of the endocrine system. It is caused by an excess of growth hormone secretion from the pituitary, typically as a result of a tumor. Growth hormone usually stimulates the liver to produce insulin like growth factor 1, or IGF-1, which helps control the growth of bones and tissues. It is controlled by feedback mechanisms to maintain balance of hormones. Gigantism occurs when excess growth hormone causes an abnormally high amount of IGF-1, which promotes rapid and excessive growth throughout the body and disrupts the balance among the hormones. How it is treated. The treatment for gigantism usually involves surgery and radiation. Surgery is the most frequent approach and is conducted to remove or shrink the pituitary tumor that is causing excess growth hormone. Due to the often large size of the tumors, multiple operations may be required. The most frequent surgical approach is the transfenoidal surgery. It is through the nose and sphenoid sinus. If surgery doesn't work to its full extent, radiation therapy can be used to target the tumor, but works slowly and can take even years and multiple treatments to produce its maximum effect. There are medications that help treat acromegaly, excess growth hormone in adults, but they need to be further researched to see if they can effectively help children with gigantism. And these are my citations.